Why, when physicians everywhere can diagnose and treat syphilis, do we permit this pale spiral germ to continue its devastation? The answer is ignorance. Ignorance is the greatest ally of syphilis.
I'll be talking about treatment, marriage and kids when you have a reactive VDRL or TPHA test. The information in this video does not apply to ELISA and CLI type of TPHA tests. Please note that VDRL, RPR are different tests, but whatever I'm talking about VDRL applies to RPR as well. VDRL and TPHA titer are blood tests that detect the level of antibodies against syphilis bacteria. These antibodies are detected a few days after the infection, but these antibodies do not fight against your syphilis infection. The answer is a bit complex. VDRL has to be interpreted with patient's history and examination. Listen carefully. VDRL test in a person who is single or is in an exclusive monogamous relationship without high risk behavior and has no symptoms of STI is mostly non-reactive. This is considered normal. The point to note is that if you have a high risk behavior and you have symptoms of STI, you can still have syphilis even though VDRL is non-reactive. Untreated late syphilis can damage your brain, spine, bones, heart and eyes. Untreated early syphilis can be transmitted to your intimate partner and if you are a pregnant woman to your unborn child. Early syphilis is curable, so see a dermatologist immediately.
Syphilis strikes infants, kills thousands. When it does not kill, it may cause blindness, deafness, insanity or deformity.
If you have a high risk behavior, self-testing does not help. You will be living in a fear of STI and you'll be wasting both your time and money. Visiting a dermatologist can help you find a solution as soon as possible.
Anyone who thinks he has syphilis should go at once to a physician because only a physician can diagnose syphilis before it makes itself known. A knowledge of the patient's history is the first step in diagnosis. Then follows a thorough physical examination. An essential part of any examination for syphilis is a blood test. Only a physician can interpret the results of the test.
Reactive TPHA means you most likely have an active syphilis if you have high risk behavior. Visit a dermatologist immediately. You will need a holistic clinical examination and lab testing based on your history with intimate contacts. Please note that TPHA titer will be reactive lifelong despite appropriate treatment. Penicillin injection in the buttock is painful because of three main reasons. The volume of injection is high, the diameter of the needle is thick, medicine is a powdery liquid. VDRL becomes non-reactive in syphilis after complete treatment except in a few conditions, but TPHA will be reactive lifelong. The number, type of injection antibiotic and the duration of treatment depends on the stage of syphilis you have. Early stage treatments are of short duration with injection in the buttock and late stage treatments are of long duration with injection in the veins. Tablets are not the first line of treatment and it is only given if you are allergic to the injection antibiotics and in other special situations. Till your treatment is complete, any form of intimate contact is not allowed. Avoid this high risk behaviors too. For a specific answer, talk to your dermatologist. Generally, you need to satisfy 4 criteria to marry. Your treatment for syphilis must be completed by a dermatologist. 2. Your symptoms are cured. 3. Your dermatologist has declared you free of other STIs. 4. You have a will to maintain a monogamous, exclusive relationship with your partner and avoid high risk behavior lifelong. If your VDRL titer is not falling or in a rising trend after treatment, then it may be due to one of the 4 reasons. Number 1, you are being treated by a non-dermatologist. 2, you are not getting the standard treatment. 3, you are continuing your high risk behavior. 4, you are testing the same tests in different labs. For a specific answer, talk to your dermatologist. Generally, if treatment for syphilis is complete and if you and your spouse do not have other STIs, yes, you can have a child. Untreated syphilis in a pregnant woman can cause abortion, stillbirth, or organ malformation. Please note that when you or your spouse has untreated syphilis or other STIs during pregnancy, it can still be transmitted to your child. Cure from syphilis can be declared only by a dermatologist when your symptoms are gone and VDRL titers are on a falling trend over time until you meet an endpoint. This endpoint depends on the first VDRL titer. Go see a dermatologist immediately. Some Middle East countries restrict immigrants with active syphilis. It depends on the country you're trying to get into. Most countries allow immigration after the treatment is completed. If you or your intimate partner does not have high risk behavior and your mother has never had syphilis in the past, reactive VDRL can be due to conditions other than syphilis. I've also talked about false positive VDRL test in another video.